Welcome to Longevity by Design, a podcast designed to give individuals access to the leading scientific information in the field of longevity. The ability to add years to your life and life to your years needs no opinion. Join us as we ask science to take the wheel. In each episode, Dr. Gil Blander joins a co-host and an industry expert in the field of longevity, shining a light and getting the answers to the key question: how can we live a longer, healthier life?
Hello, I'm Ashley Reaver, and I'm joined by Dr. Gil Blander. Welcome to Longevity by Design, How to Live a Longer, Healthier Life. We're produced by Inside Tracker, your science-based guide to optimizing your body from the inside out. Our guest today is Dr. Mariette Abrahams. Mariette Abrahams has a PhD in personalized nutrition and MBA and is a registered dietitian, as well as the founder of the company Kina, a hub for insights on personalized nutrition. Dr. Abrahams aims to bridge the gap between academia, research, industry, and frontline health professionals. She develops personalized nutrition products, services, and platforms that are evidence-based, representative, equitable, and ethical for individuals to take charge of their health. Thank you so much for being here today.
Thank you. Thank you very much. I'm very honored.
So Mariette, it's a big pleasure to have you with us today, and we have a history of interaction in a lot of conference around the personalized nutrition, and I always admire your knowledge and connection and understanding of personalized nutrition. But maybe let's start from the beginning. And you have a very interesting academic background. You have a MBA, RD, PhD. So what is inspire you to spend so much time in learning and becoming an RD, PhD, and MBA?
Yeah, I think it's very interesting because I'm always a lifelong learner. So I'm never happy with what I know. And I always think, there should be something new. There should be like a new way of doing things or a new way of seeing things. So I guess my initial interest was always in kind of health and nutrition. And it's not by any means influenced by my family. My family was not, health conscious or health fanatics or, self-quantified or anything like that. But I guess I always knew that I was, very sporty. I loved the way that I felt when I was healthy and what I was eating. And I made that connection very early on. And so when I was finishing high school, I didn't really know what to do. And the career counselor said, well, you're always like so healthy and you're always so interested in nutrition. There's this course called Dietetic. And I'd never heard of it before. And so I did it. And then even then, so this was in South Africa. I believe that, I then had the skills and the knowledge to then apply it into practice. But of course, it was very much focused on clinical nutrition, medical nutrition. And so I ended up working in the clinical field, specializing in more nutrition support, worked in the NHS in London for many years, it's like 8 years. But I was a bit unhappy. I was a bit unhappy about the status quo. And I knew when I started in the hospital, I'm not going to do this for the rest of my life. I need to do something else. But I wasn't passionate about any one particular area that I thought, right, I'm going to specialize, do PhD. And I thought, no, I need to diversify. And that's when I started in clinical. I automatically, I think it was a year after I started an MBA. And I thought, I need something to diversify my skill set, the way of seeing the world, something that I can add on top of my clinical skills. And so I did that. And then it just naturally led me to a role in industry, in medical and scientific affairs for a specialized medical nutrition product. And that gave me insight into industry. And then this whole area of technology opened up. And that was kind of the bulb for me. We spend so much time working on sickness and helping people with products to manage their disease. What if we just use technology to enable people and educate people and inform people much earlier on in terms of prevention? And that's where the switch really happened. And I thought this is, and then it was, it's called personalized nutrition, or it's called tech-enabled personalized nutrition. And that's where it started. And so that was around 2012. So as you know, at that time, there wasn't really much happening in personalized nutrition. And I thought, you know what? This is going to take some time. I need to bide my time before this industry sort of kicks off. And so, although I say my PhD was in personalized nutrition, it was really around combining how do we get the science and this new technology and empower the frontline healthcare practitioners to integrate these new technologies and open up this new way of thinking and focus on prevention and leveraging what we have and what's coming in this new era. And that's really, so it was a mixture between psychology and business and healthcare practitioners. So I did my own thesis. Yeah, I devised my own thesis. It wasn't given to me. And so that rebel in me is always the one that drives me to doing new things in a new way and learning new knowledge. And so there's so much more to come, but that's what got me here.
Interesting. And on top of the interesting background academic-wise, you also, if you're looking geographical-wise, you are also have been traveling around and coming from different continents and different countries. Can you a bit discuss the path of the geographical
Yes.
path of your life?
Yeah, that's an interesting one. And I don't actually remember telling you this, but when I was born in the 70s, I was an apartheid baby. So my father was, an activist, and he was one of the people who, together with, Alan Boesak, Desmond Tutu, all these leaders, Mandela, all these leaders were against apartheid. And so it was a time when I was 4 years old where basically he was told, you need to leave the country or your family's at risk. And so that's basically what happened. So we left. At that time, the European government sponsored, education, and we were basically refugees. So you can imagine that from 4, I was not really in South Africa or a South African. And so that meant my whole childhood was spent in Europe. And then by the age of 12, my dad finished his PhD. And so we went back to South Africa. And because it was still segregated then, I was like, what is this? What is the segregated schools? And I couldn't continue with gymnastics. I couldn't continue with music. We had to live outside. It was such a huge change. And I said, as soon as I finish studying, I'm getting out of here. I'm leaving, and that's what I did. So I always had this nomad, vibe in me that I'm happy wherever, and my home is wherever I am happy. And right now it's in Portugal.
Cool. That's very interesting. And going back a bit back, when you finished school, you worked at the NHS in the UK and also at Nestle. So can you describe what have you done there?
Yeah, so in the ward in the NHS, I was specializing in gastroenterology. So my pure focus was on Crohn's disease. I was fascinated by Crohn's disease, and at that time, that is what really sparked that nutrigenetic aspect, because at that time it just came out that what is this thing? Is it genetics that some people flare up more than others? Is it that, the environmental component of people who moved to the UK, third generation, they flare up more than those? Why do some people respond to a liquid diet that we were given at that time for 6 weeks and other people just didn't, and we needed to change, So all these different, aspects of Crohn's disease was fascinating to me. So it was really around gastroenterology and intensive care, nutrition support in ICU. And I was in charge of the nutrition team. So that meant that right from the beginning, we always worked as a multidisciplinary team. So whether it was with the surgeons, with the gastroenterologists, with the biochemical pathologists. And so we had I always had a real good understanding of, nobody can know it all and nobody can achieve success on their own. If you're going to help a person, you need to take the person first and then understand how can the team help. So that was fascinating. And then I moved to Nestle, which was really around So the product that we used in the hospital was Modulin. And so when I went to Nestle, that was what I was responsible for Modulin and Peptamen. So it was a natural move for me into that role. And so that was really educating, was it consultants in the hospital? Was it specialist dietitians? Was it, specialist nurses, for example, about, the existence of the products, but also how to integrate it into practice, not only as in here's the product, but here is a program to use, a liquid diet as part of a treatment option for people who wanted it, because it was used very much in pediatrics, but it wasn't so much used in the adult care. So it was really about, it was about education, but it was also about working with the team in Lausanne, for new product development, and kind of, because at that stage, the use of liquid diets in Crohn's disease was way advanced in the UK in comparison to other countries around the world. So we were very much the kind of, focal point, I would say, or the teaching point. And that's what was my responsibility.
When you say Peptamen, I'm getting flashbacks to my dietetic internship because I never worked in clinical. I knew that wasn't my path. Fortunately, I came to Inside Tracker pretty early in my career, but that was funny. I haven't thought of Peptamen in a very long time.
And
go ahead.
No. I was going to say it's interesting because I think in dietetics you learn so much, and then when you get to the actual real world, things change, and you realize that actually, while you should do things on paper, it's not what happens in practice, because there's so many other factors that go. I didn't have to really talk to a surgeon. I didn't really have to think about contracts in a hospital. I didn't have to think about so many things. But when you get into the real life, things change. And this is probably why, my dream was to become a clinical dietitian. And then when I got there, I was like, year one, no. I need to work on my exit strategy. But I still love it, because I wouldn't have also had the knowledge and insights that I have now if I didn't have that as 8 years in clinical practice, because it helps you to understand not only the system, but also how people, whether it's patients or consumers, behave and think about, from prevention all the way to now that I'm lying in hospital, what could I have done differently, or how can I prepare and inform my family to do stuff differently? And so it has given me, I feel, a very, very well-rounded experience.
And you also have some public health experience. Can you tell us about your work in that area of dietetics?
Well, I wouldn't say public health as such. I would say right now it would be more around how can we work and collaborate with industry and bring in the healthcare professionals in a different way in terms of public health. It's not so much, public health messaging, I would say, but I think we are in a new age and a new stage of how public health is delivered and should be delivered, and how we are in a different era in terms of technology, that we can use these tools now to bring about public health changes. And that's where, but public health per se, I haven't been involved. I've gone straight clinical to industry and now consulting, I would say, for the last 10 years.
Okay. Let's see. And also, I think it's interesting to get your perspective on the food systems all over the world, since you've been participating in some way, food systems from a lot of different areas. Yeah. That's shifted tremendously over the past 100 years from, just a focus on feeding the population to now trying to look at food quality. What do you think has contributed to this shift?
Yeah, I think people or consumers have now, realized, and I think the COVID pandemic has really sparked a change in people, in that, food is more than just, comfort and your happiness and your family and your culture. It's actually such a pivotal role in your actual health. And we didn't really have that before. And I think now people have made the connection, but whatever I eat actually impacts my health and my mood and my gut and my immune system. And so all of a sudden, people are paying much more attention to what they are putting into their bodies, what they are buying, how they are cooking things. And so that's influenced what people are buying. Yeah. So people are spending time in the aisles or spending time comparing, ingredient lists and what the family is cooking or what my friends are buying as well. And so that has really caused a shift, not only in terms of what is in the food, but also where it's coming from, how it's made, and what is the impact of what I choose on the planet. And so that has really influenced, I would say, the interest and awareness in going more plant-based. We've seen all of a sudden a spike in people, eating more fruit and veg during COVID. And now all of a sudden with food insecurity, with a food infect, it's the first thing that's going again. So we can see that whatever is happening around the globe is influencing how we personalize our own diets, on a day-to-day level. And so whether that then influences how we think about how it impacts our health is then another level, because we choose the foods that we can afford, but then we also want to choose the foods that have a direct impact on our health. And then we choose the foods that we know will impact us in the long term as well, so we can prevent disease and prevent, complications or prevent symptoms. So I think that's another thing that has shifted in me, because I was very much in medical nutrition. Yeah. So take the stanols, eat the legumes, reduce saturated fat. But now I think about it differently. Now I think about, how does that translate? We used to give lists of foods to buy in the shop, when people come into clinic. It's not practical. I'm thinking, why did we do that? It doesn't work, because people don't eat a list. People don't eat ingredients. People want to know, how can I make this practical? How can I influence this in terms of a meal that my children will actually not cry about, when I serve it at dinner time? So I think we are now at a stage where there's this gradual shift in terms of, okay, I all of a sudden became aware, and now all of a sudden made major shifts. And now I need to now come to a level, to the middle ground. What is going to work for me? What can I sustain in the long term to work for the planet and work for my health as well? And that's what's currently influencing the food systems, to force them from consumer driven, for it to be healthier and definitely more personalized.
So Mariette, before we'll go to personalized nutrition, I heard you talking numerous times, and I've seen your passion for helping the underserved, subpopulation that have some issues, people in color, and also women versus males, and so on. Can you describe it a bit, and what are the gap, and why the food is mainly designed and prepared for white males, and how can we change it?
Yes. And I think it's a topic, that I'm very passionate about, because I see that things are not really improving at the rate that we would like to see it improve. And it's historically, it's not a new thing. We've known this for a long time, but now we have the research and the data to back it up. and that's where it comes in. So people are more informed now. So the problem that we are having is, we are now starting to, I guess, recommend, specific foods or specific functional foods, but we don't have, and that's as a blanket, to improve X or to improve Y. Whereas we don't really have the research to back up that this works in minority population or specific racial groups, because they just haven't been included in the studies in the first place. And that goes for food, or it goes for medication. And so unless we include and have representative groups from the foods that they are actually eating, we can't even start to build algorithms to give personalized recommendations. That's the one thing. The other thing is that we've always come from a point of, well, let us tell you what is healthy based on what we think is healthy, because ethnic foods are not healthy, or the way you prepare foods are not healthy, or the way your cultural, cuisine is not healthy. And so unless we change that perception of, what are you eating? What is available in your, in your environment? What are the social determinants that determine, that influence how you choose foods? We're not going to ever get to this point where we are really making it more accessible and making, personalized nutrition more available. And so there is already this mistrust in science, this mistrust in research. And so unless we have our own researchers research the issues that are really pertinent to our health, whether it's cancer, whether it's the increased risk of diabetes, whether it's the increased risk of kidney disease, whether it's the higher rates of cancer, for example. These are things that are pertinent, but unless we understand what are the cultural roots of how we choose foods, what are the implications of how foods are prepared, and how we can start with where these groups are at, then we can change. And so I fundamentally feel that if we're going to change the system, if we're going to make solutions that really impact the people that need it the most, we need to start where the people are. And that starts with research. That starts with doing research that is relevant to the groups that need it the most, but also not doing research in the centers that, come to us and then we will tell you what you should be doing. No, it needs to be out where the people are, using and leveraging technologies that are currently being used so that we can get the data that is representative. And then we can start involving more and more, educators, policy, academia, more frontline healthcare practitioners to really make it more accessible and affordable and equitable, with using the science that they can trust, because at the moment it's just not.
Yeah, that's incredibly interesting. I think incredibly important to broaden the conversation as well of who has access
Absolutely.
to personalized nutrition right now. It's a very small group of people.
Yeah. And I mean, I think it was just last week, the FDA has written guidelines now, or draft guidelines, just to increase the diversity, because yes, there is a group that's included, but it could be 5%, of the total study group, or it could be 3%. So yes, we did it, but it's not really representative of that, so let's be honest, this is where it's at. And so we need the regulators to step in, and we need to say, put a quota on it, put a number, put the regulation in it, put some oomph behind it, because otherwise, I don't want to say Black Lives Matter, we just see this blackwashing of photographs. Everybody's putting black girls, black people. I mean, that's not what it's about. If you are truly standing behind inclusion and diversity, you need to put your money where it really counts. And that means in research, giving the money to the people who need it, who want to research and really make an impact. And that's how we're going to affect change.
Absolutely. Well, and I'd love to continue that conversation of what your definition of personalized nutrition is, because it sounds like it's probably a bit more expansive than we've talked about, even on the podcast so far. So can you explain kind of the basis behind it, how you define it, why it is really truly personal?
Yes. And I think this is even in personalized nutrition, I think, there is a slight difference in terms of how we define it. For me, as somebody who's trained in nutrition and dietetics, for me, it's quite personal. So for me, it's about how do you provide actionable advice that is relevant to the individual, that has an outcome, but that outcome can be a health outcome, but it can also be a behavioral outcome. And so to me, the personalization can be anything from, prevention, providing that personalized advice from prevention, how you can prevent, a disease or improve your health, all the way to medical nutrition, where you already have the condition, and now we need the specialized products to help you to, improve the condition, or reduce the symptoms, or improve your biomarkers. And so for me, personalized nutrition is on a wide spectrum. It can be based all the way from taste to lifestyle, to cultural, to religious, all the way up to the omics. But it needs to be relevant to the individual, and it needs to be actionable by the individual. Yeah, so it's not just about, again, giving the list, but does that person, did you provide the information and the advice that is relevant to that person so that they are enabled now and empowered to make those changes? And that's what it's about.
So, Mariette, there are a lot of products currently in the market that using personalized nutrition, starting from questionnaire to looking at microbiome, blood biomarker, and so on. So, in your opinion, what is the right mix, and what is where are we today, and what is your opinion about personalized nutrition and the inputs that basically help the algorithm or the person to make the decision?
Yeah. And I think this is very important, Jill, because I think some people think, well, you need to automatically have, like, you need to have a microbiome test, or you need to have a blood test. And I don't think that's the case, because I think where people are, the majority of people just want to know, what little thing can I do today to at least feel that I'm working towards a healthier life? Does that mean I just learn how to increase my fiber intake? Yeah, with what I'm already doing. What can I do practically? Does that mean I need to eat, 2 apples a day? Can I just do that, and keep that up? I think that's already personalization. So there's a group, and I think this is the majority of people, want to improve their lifestyle. They just want to eat healthier. They're not necessarily worried if their diversity, their microbiome diversity has improved by 30 points. They're not interested. All they want to know is, what can I do today? And that's not going to require a lot of behavior change and impact my life too much, just so I know that I'm doing something for myself today. That's where I think the majority of people are right now. And I think in terms of what we have in terms of solutions at the moment is we see a lot of rapid growth in these solutions that help people shop better, that guide them towards healthier options in the store. And I think that's great. And I already think that's personalization. Yeah, I think the people that have higher levels of health literacy, food literacy, awareness of the impact of food and food composition, nutritional analysis, they would be at the level where maybe we have the blood biomarkers, yeah? So they can relatively know, okay, this is what I need to check for and see what impact that has, yeah? And I think with that, we see a lot of people now being way more interested, because it really comes driven from them, because they want to know their vitamin D level. But the doctor doesn't want to check the vitamin D, because why? I'm not getting reimbursed for that.
It's too expensive. That's why.
So they don't want to do it. So people say, well, actually, I know that it's important. I've read that it's important. I continuously see that it's important. So now I want to know what it is. So that's where personalization. So I think there is, there's a gap. There's solutions for people who want to know that, and I think that's great as well. But I think we also need to be very careful in terms of what is medical nutrition and what is really wellness and informational. Vitamin D to me is informational. Yeah, where are you at that level? That's great, whatever. When we get to things like cholesterol or liver function tests, then I get a bit nervous. And that comes from my clinical background. Like, I don't really think you should have that without any healthcare professional interpreting that for you, explaining that for you. It should just be freely available. And so I do think there's a level where maybe the regulation, or there should be a bit more control in terms of, yes, wellness is good, but when it gets more complicated and there actually needs to be more contextual information about your family history or how you interpret that, then you need a healthcare professional. And I don't think Dr. Google can do that for you. And so there is a distinction with that, and we definitely need to have better control, or needs to be better controlled. And then I think at the high level I think there's a lot of controversy around microbiome tests as well. People say it's too early. I do agree that we can't give very specific information about how much lycopene you should be having, or how much vitamin C based on your microbiome test. But I don't actually think, for people who are interested, is saying, did my microbiome diversity improve I've now slept better, I've now exercised more, I've now improved my diet. What did it have any impact? I think data can be powerful for those who, want to see if they're on the right track, not to give a detailed magic bullet, but to see, hey, did it make a difference? Because how else would I know? So I think there is a level of, difference in terms of the offerings we have right now, but and we have a different level of transparency in the industry. That is for sure. So not everybody's transparent about what science they base it on, what is the state of the science, providing those scientific papers and things. So I think there's a lot of work still to be done, but I think it's exciting that we have the option. So where we were is people just wanted a test and a report, and then they realized, actually, I don't understand what's in this. Yeah. Then we got to the stage where, hey, it needs to be actionable, and I need to change my behavior. If I can have all the data that I want, but if I'm not willing to change my behavior, data is not going to mean anything, and tracking is not going to mean anything. So now we have this wave or the last few years of, unless behavioral change is incorporated into the solution, it's not going to go anywhere. And I think where we are going now is, well, it's about prediction. Yeah, it's about, well, we know now this is happening, or we can see that this is happening. How can we prevent you from going down the wrong path? How can we nudge you towards the right direction? How can we non-invasively track these biomarkers or get this data that we can then inform you at the right time what you need to do in order to prevent X, Y, and Z. And that's where we are heading. But right now, I think we now have this awareness, and there's a lot of work to be done in terms of behavior change, because we don't know what behavior change works for whom and which combination and in what format and how often and through whom, because people are at different levels in their health journey. And so we need to perfect that. And so I think we are at a stage where we have a lot of solutions. We don't technically need more in the industry, but we need to combine them in a better way so that we know this works better for that person, and that inspires them to sustain it for a longer period of time, because adherence is going to be the key outcome.
Yeah, I think that you well said it. And actually, yesterday, Ashley and myself had a session with an expert in behavioral change, a professor from the academia. And we are developing a new product. And what he said was great. He said, it's very hard for me to give you an advice because I'm dealing mainly with a population of sick people, and your clients are not sick people; they are healthy people, and I don't know if the tactic that I'm using for sick people will work for the healthy people. So I think that there is a lot to learn and to apply in order to give a good service for healthy people.
Yeah.
And I think that. But anyway, it should be based on science. So I 100% agree with you that everything should be based on science. We have a very good scientific community. Again, we have some holes there, so not everything is perfect, but they are doing a good job. And we need to apply the best science in order to allow us to provide the best personalized nutrition. So thank you so much for being one of the leader in the personalized nutrition domain. That's exciting.
Well, I look up to you so much. No, it's an exciting area to be in.
Yeah, and let's switch to your business. So you are the founder of Kina. Can you tell us a bit more about the company and what you are hoping to achieve with Kina?
Yeah, Kina has been very fascinating, such an enriching experience. And basically, I'll tell you how it was conceived, because basically I came with my clinical experience, as you've heard, and then I came with my business experience, and then I had my industry experience, and I said, well, this personalized nutrition industry is up and coming, but for me there's a gap, and the gap is that what I see is that in the industry there are companies that are very good at the tech. And they're companies that are very good at the marketing. But what they didn't have was a very good understanding about what actually happens in the clinic. Like what guidelines do people use? How do you translate the science into actionable information to the individual who's sitting in front of you. And so to me, it wasn't about, a blogger or, a guru or something. But it was really about, if we're going to help people, get healthier, we should use the right language with the right science and feed that in, because I feel like, dietitians have this rich expertise and skills. I think one thing we are trained in very well is to be good listeners. And I think that is missing when you come from a very strong marketing background or very tech background, because the listening and the communication is key. Because somebody might be telling you something, but they mean something completely differently. And that is the key for dietitians to pick up and say, actually, never mind that, you are smoking or that you don't exercise. Actually, the fact that you lost your mother a month ago, it's the emotional part. That's what we need to focus on. It's the behavioral part. And so, focus on the things that really matter to the individual and identifying the problems. And I felt that there was a gap for industry, is to leverage those skills and tap into the mind of a dietitian. Now you see everywhere, dietitian in your pocket, dietitian in your pocket. But that's essentially what they discovered. Yeah. So what we wanted to do is be that external nutrition and dietetic department for companies. And so in the beginning, 10 years ago, it was very much around providing domain expertise. So, the scientific expertise, whether it's, a specific disease focus or, providing the literature for, what are those guidelines based on, to building products. And now, 10 years on, it's really shifted to providing strategic advice and market intelligence, also because we've been in it so long. So now for us to see the trends or to spot the gaps is actually quite natural. It's quite easy. But what we see now is that with technology, there are things that help to make it easy. So we don't believe that the dietitian can be replaced. But we do believe that the combination of the dietetic skills and knowledge can be combined with the understanding of the technology and then offer that as a service to companies. So how we are doing it right now is we are providing the domain expertise as a consultancy service. So that continues. So we do that in terms of innovation projects, for example, helping companies to find partners in the industry, helping to devise, project designs. And so that is really exciting, because 10 years ago, people were very risky. Yeah. So they're like, no, we don't want to do any risky. We don't want to risk reputation. We don't want to do anything. We don't want to waste money. 10 years down the line, now it's, what can we do? Like, if we don't do something, somebody else is going to do it. Like, we need to try something. So we are completely different. And now it's very exciting, because we can devise these innovative projects without having this limitation and restrictions on them. And then on the other hand, we have just developed this. So on the one hand, we have this platform, which is a database of personalized nutrition companies within the industry, that people can use, at our advanced search filters to search for companies based on the segment that they're in, based on the business model that they have, based on the channels that they're selling into, based on the languages that they're offering, based on the pricing as well. But then we also offer the content. So we can then write reports or write articles on personalized or topics within personalized nutrition that are very important. And then we've also now just developed this text analytics solution, because what we find is that people talk a lot about products, food, health, what they are doing online all the time. And so maybe evidence-based is then limited, because what you are doing in a clinical trial is very much controlled by, where they are or what they are doing, and maybe what they are saying. When they are online, they share everything. Unrestrained, so you can get an unfiltered view about what they really think and do and behave, and compare that against what the science says. So what we now do is we leverage text analytics and use text mining and doing topic modeling, for example, and then identifying what are the things that are people doing online, doing and saying online, and comparing that with the science, and then putting our nutrition and dietetics hat on and explaining that in a way and say, okay, basically people are behaving in this way because they like X, Y, and Z features, of this particular product. And the reason why is the science has shown that in behavior change, these features are good to change X behavior or to influence that behavior. And so we can leverage the technologies and combine that with dietetics to then offer a completely new service. So and also innovate new products. So we are looking at it more from a food point of view in terms of, developing new products as well, on how people are solving their problems. What are people doing to deal with their, with their blood sugar levels or improving their heart. And so there are a lot of opportunities, but for Kina, where we want to be is being that hub of data and insights specifically for personalized nutrition. And I can add in there as well for innovation, but we only want to focus on nutrition because it's so wide and you can go so big that you can't be the expert in everything. And that's, what we realize now. We've definitely I've gone from Crohn's disease, to now being more higher level and understanding what is driving what is influencing what in terms of how people use food and nutrition to improve their health. And for that, we need to know a lot about regulation, a lot about, social determinants, a lot about, a country level data in terms of health literacy. So there's no way that one thing is going to solve all the jobs. And I don't know that we ever going to get to 100% personalization. Not in my lifetime. I don't think so. But with a learning mindset, we can always work towards it. And that's where I think as long as we empower people with where the science is and where it's at and how it's evolving and what we are learning to continuously develop new solutions, that would be the drive for Kina.
Yeah, and to add to that, Mariette, so I'm using your newsletter, the weekly newsletter, to get an update on personalized nutrition, a weekly update. And I'm pretty busy, so it's great for me that you're doing all the work and giving me the information. And it's not only on the industry, it's also on the science. So I'm receiving a lot of updates that then I can distribute to my team and let them read the paper. So I want to say that at least for me, your service is very valuable. And it's very exciting that we have someone that doing the hard work for us.
Thank you. Yeah, no, we love doing it too. And of course, what we found with the newsletter is that we forget where we wrote it. So that's why we've uploaded all our newsletters also into this text analytics solution. So we can quickly go back and say, what was that thing about food insecurity? What was that thing about, so everything is coming together now into one big Kina engine, so to speak. So it makes it easier as well.
And you're clearly so passionate about it. If I wasn't already a dietitian working in personalized nutrition, I think I would change my career. It's clear how much you care about this.
I do.
Love to know, a little more about the background behind the name of Kina, which you told us a little bit more before we started recording.
Yeah, so Kina is a Zulu word, and that's also because I'm South African. I'm not Zulu, but I'm South African. And Kina means be strong. Now, for any South Africans listening, they would be very upset with me because the proper pronunciation is Qina with a t sound in Zulu. But we pronounce it as Kina because we know that's internationally probably easy to remember. But yeah, I wanted something really short and something that had meaning. And that's how Kina came about. I did some research and that's how Kina came about. But yeah, lots of people ask me, is it Quina? No, it's not Quina, it's Kina.
And something that you mentioned before that I think I want to loop back to is all of the different inputs that we need to be able to understand how to give someone the best personalized nutrition experience. A few of the things that you mentioned, access to foods, social determinants of health, their situation in their government, perhaps other things happening in their life. How do you see that process of us being able to collect that on a population level to really be able to deliver that personalized nutrition?
Yeah, I mean, I think we are at a stage now, and I would say, especially in the US, where there's a realization that personalization is the future. Yeah. And so they've pumped in a lot of money for it. So unless we get government involved and industry working together, it's going to be very difficult for one company to do it all, because I think this mass domination of personalized nutrition is not going to happen. Yeah, it's just not going to happen, because people are motivated by different things. And so that's why I think we need to have this big partnership in order to collect the right data and quality data to then make it accessible as well, so that we can have different strokes for different folks. Yeah. And in different languages as well. That is very important, because it's the world is becoming more diverse, and we can see at this time that economically the gap is widening. So unless we fix that now, we're going to have a problem. So I do think that the public partnerships, people being also willing to share their data, voluntarily, if they know where it can be submitted and where it will be stored safely. I think in the future people will have more control over their own data and who they share that with. But the only way it's going to happen is if there's collaboration.
Sure. Definitely important. And how do you think that, speaking on kind of government entity levels, taking that, coupling that with your clinical background, having experience in NHS, how can the healthcare system really even start to leverage a lot of personalized nutrition in order to take a much more preventative approach, at least how we see healthcare in the US? Are there any existing barriers that you think are preventing healthcare from doing that today?
Yes, money. It comes down to money, because at this stage in Europe, anyway, you can see a dietitian maybe 2 times, maybe 3 times, in some cases more times, if you are sick. If you already have something, then you can see a dietitian. And so if we are truly passionate and serious about personalized nutrition, we need to flip it on its head and say dietitian on tap from whenever you want it, maybe from the minute, I would say start with the mothers. The minute you are pregnant, or start with that. Start early. That is going to be the key. And so unless we make it easier for people to access quality information, because now we have nutrition experts galore, and consumers don't know what is credible or what is not credible. Yeah, they try to do more research, but it's very difficult for them to find who can they go to. They can search online, yes, but they still want to speak to an individual as well. And now we're at a stage where the healthcare professional, the dietitian, is becoming more of a coach. And so it's not so prescriptive and come to me and I will tell you what to do. Yeah, it's now needs to be more of a team sport, and saying, when you want to know something, let me know. When you want to have information and you're standing there, or you're thinking about food, or you want to make a decision, I'm here. And that needs to be reimbursed. And unless that changes and we make it easy for people to access quality and credible science-based information, it's going to be hard. So we need to change that paradigm of sick first and then get advice. That's where I think. So it's regulators, it's government funding, it's reimbursement, and then we need to change the how we identify people. So we need to identify people early who are motivated to make those changes, and identify ways to find the people who are not yet motivated, but probably don't understand yet that food has such a powerful impact on their health, in the short term and all the way into the long term. And so there's a lot of work that needs to be done, but unless the governments put money behind prevention, it's going to be hard, because people are not going to pay out of pocket. They're not going to pay a dietitian $150, $200 an hour, to see them one-off. It's just not going to happen. So we need to make it easier.
Yep. At least in the US with the Affordable Care Act, most plans, if people don't know this, they do cover 3 preventative visits with a dietitian now. It depends on, the level of plan that you get, but a lot of people do have access to that now and aren't aware of it either. But on that note, how about food companies? Do you feel as if food companies play a role in or can play a role in personalized nutrition?
Absolutely. Absolutely. And I think if they don't, they will become irrelevant because people choose with their wallets. Yeah, people are more savvy now. It's not about, they are not influenced by marketing as much as they were in the past. They're not as influenced by, pretty packaging as they were in the past. And so they want to see efficacy, they want to see cleaner labels, they want to see sources, they want to see traceability. There are a lot of things that has forced food manufacturers and companies to change how they do things. The question is, or the magic question is, how do you change a big machine? Yeah, how do you change, companies that have such big manufacturing sites and things? So how we are seeing this right now is that personalized nutrition is a reality, and there's an understanding that personalized nutrition is a reality. Whether you do that in small steps, whether you do that on a lifestyle level, yeah, it may not have to be completely personalized, but at least are you putting in the healthier ingredients? Are your nutrient profiles better? What are you doing in salt reduction? What are you doing sugar? So all these things all filter in, and it comes back to Jules' question. All filters into personalized nutrition, whether it's just reducing your sugar intake on a daily basis to all the way, knowing exactly how much protein I should be taking, to prepare for my marathon. So we are there, but we are very early on. That's all I can say, is that we are very early on in that process. And at the moment, what I can see is that smaller brands are winning out because they are closer to the consumer. And coming back to that, understanding what people really do, what they say they want, in a focus group or in a survey, and what they really do. And so what these smaller brands are tapping into the data. They are seeing what people are clicking on. They are seeing what product codes, barcodes are being scanned. They have an understanding of what people are interested in, and then they formulated that, whether it's based on taste or whether it's based on health goals or functional, ingredient. That's the way it's going.
So Mariette, this podcast, the name is Longevity by Design, and we definitely think that nutrition is very interesting and very exciting, and we believe that there is a lot of interaction between longevity and nutrition, and I will discuss it in a second. But we also, if we think about longevity, there are two main terms that we like to say. One of them is the lifespan. So basically, it's the time that you live from birth to death. And the second is the health span. Basically, the time that you live from birth until you start to be sick. And so my first question is about the health span. What do you think is the role of personalized nutrition in improving health span?
Yeah. I think it's the number one. I think what we eat, what we put into our mouths, on a day-to-day basis has an influence on our health. And if we are healthy, then we will live longer and we will live a longer quality life. I don't think lots of people can argue with that. I think we have enough evidence to show that foods has an impact. The problem is our environmental influence, our environmental impact. Yeah. So at the moment, you walk into the store and you are inundated with products. Yeah. And there it goes out the window. Women are working way more now than 60 years ago. And so your time is shorter, your lifestyle is busier. And so your home cooking goes out the window, and then you order in. And so I think that the message that a good nutrition, personalized nutrition that works for you, where not only you improve your health, but also gives you a quality of life, is there. What we need to do a better job of is how can we communicate better the influence of our environment and help people with actionable tools to control or manage their environment, because I think that is where the problem is. Life is hectic, life is busy, things get in the way, and then your eating habits are the first to go. You're upset, you're stressed, fridge. cupboard,
Yeah.
drawer. And so I think that's where it comes in. But I think many people understand. I do think that many people understand that food is a key to good health and a long lifespan.
Interesting. And let's say maybe it's a hard question, but anyway, I will ask you. So, if someone or a population will eat in the right way, in the right, exactly by the book of the personalized nutrition specific for them,
Yeah.
what, in your opinion, will be the effect on their health span and on
Yeah.
their lifespan?
Yeah. I think that's an interesting one, because I think people look at their parents, right? People go, well, my dad lived to 98, and he smoked, and actually, that wasn't too bad. And so I think that is the first thing that people connect to is how were my parents? What was the health of my parents? And we were also in a very paternal healthcare system. So I think those two things go together. Yeah. So you go to the doctor, I have a pain, you take this and you do this, and off you go, and they listen to the doctor. But now with the trend towards personalized medicine comes the trend in personalized nutrition. It follows it. And so naturally, what works for the one does not work for the other. Yeah. Your dad may have been drinking and smoking and still lived a long life, but that's not going to work for you. And so what we have now is the ability to test, to see how you respond, or to see how you respond to a specific dietary pattern or your lifestyle, or how your very busy work schedule is impacting the quality or your phenotype, let's say that way. And so I think with personalized nutrition, we have the bonus of being able to track ourselves and self-manage rather than waiting for something to happen to then be able to go to the doctor. And that is the key towards a better health span, is to be able to see and nip it in the bud, so to speak, pick it up much earlier than what we would have done before we became symptomatic. And I think that's the key. That's where personalized nutrition comes in.
Interesting. Thank you.
Yeah.
You
Well,
don't seem
and
to
one
agree.
final.
No, I'm
Oh,
not at
okay.
all. I agree. I think that I definitely think that personalized nutrition has a very important role, and I see in the literature that your behavior might influence more than your genetics. In some instance, the genetic cover only around 10%, and the rest is the environmental and the behavior. And if you think about nutrition, we are making around 200 nutrition decisions a day. For exercise,
Absolutely.
we might make 5, but for nutrition, when to eat, what to eat, how to eat, I smell it, I see it, I hear it, and so
Absolutely.
on. So no doubt that, in my opinion, nutrition is by far the most important, the most complex issue that we have.
Exactly. And it's so personal.
Yeah, it is personal. Yeah, my taste might be completely different than your taste.
Exactly.
Yeah.
All right, one
You're
final
going to say
question
something
that we
else.
ask to all of our guests is there one decision that you make each day based on nutrition or health span or lifespan that you can share as a tip to our listeners?
Yes, I do. And I think maybe lots of people do it. But in the morning when I wake up, I tend to think of two things. A, what is on the menu for today? Yeah, what am I going to eat today? So I already know in the morning what the diet is going to be like for the rest of the day. So I don't tend to go off it, or I tend to stick to that, and I think in colors. Okay, like what's for breakfast? Is the rainbow wheel included? So I tend to think of that. The other thing I tend to think about is, how can I work in physical activity into my day? Because I've got meetings, I've got a podcast, I've got this, I need to prepare a presentation, I need to read it. When am I going to get up and work that in? So sometimes it's in the morning, Sometimes it's a walk at the end of my day. Sometimes, like now, it's like, while my kid is at music lesson, I can quickly hop into the gym. And so for me, I think for me, longevity is about planning. Yeah. You need to know where you are going. You need to think ahead. You can't think today, I'm going to just do it for today because I read an article about longevity, and so I'm going to do it today. But you need to think long term about how you can do this every day. And I think setting yourself up in the day to think longer term about your health. I'm at the moment disease-free, symptom-free, thank goodness. But that's how you got to think. You need to start with a plan. And if you plan, you are less likely to fail because you know what is expected, what you expect of yourself in order to have a long and healthy life.
I think that's incredibly important, having intention behind your decisions instead of just letting your health happen to you.
Yeah. Otherwise, it's like self-help books, right? Everybody buys them and then they sit on your shelf. And it's like, I was going to do that. I was going to implement that. No, you need to wake up and think, what my food has a big impact. What am I eating today? And then how manage your stress or whatever, but also think about how you're going to work in your physical activity for the day. And that's going to set you up for a long and healthy life, whatever might come your way.
A great thought to end on. Thank you so much for being here, Dr. Abrahams. Incredibly enjoyable and invigorating.
Thank you.
Thanks
so much. It was a great discussion. Greatly appreciate it.
Thank you, Joel. That was great, and I hope to see you soon.
And we look forward to exploring the research in the field of longevity each month with you and the leading scientist. For more information, please go to www.insidetracker.com/podcast.
Thanks for listening to Longevity by Design. Please subscribe to this podcast on Apple, Spotify, or YouTube. Longevity by Design is powered by Inside Tracker, a personalized health optimization platform that helps people improve their lives by improving their bodies from the inside out using personalized, science-backed recommendations for nutrition, supplements, and lifestyle changes. To learn more, visit insidetracker.com/podcast.